Good day to all. I'm your caregiver for today, Lou Pastor, and I'll be presenting to you how to use and care for a nebulizer as well as the proper administration of an eardrop and an eye drop. Now I'll be showing you how to use and care for your nebulizer. In front of me is a standard nebulizer which can be bought in any pharmacy or nearest medical equipment store. It comes with a compressor, the tube, the cup, the mask or another inhalation apparatus, and standard medicine that can be prescribed by your doctor. To operate, using the cup, you place your medicine inside the cup and use as prescribed by your doctor only. You open the cap of the cup, you place the medicine inside, and then seal. Now, you connect the tube to your cup onto your compressor. Select which inhalation device or apparatus do you want to use and place it on top of the cup securely. Once everything is connected, you place the cup and secure them on your face and then turn on your compressor. Once done, you turn off the compressor. You take all of the parts apart, starting with the mask, the tube, then rinse all of the parts onto a warm water or warm running water. Every week, sterilize all of the equipments into a boiling water for 10 minutes, then put it on a clean paper towel to air dry. Another way to sterilize is by soaking all of the parts onto a 3 cups of water and 1 cup of vinegar. Soak them for 10 minutes, then place them on a dry and clean paper towel and let them air dry. Once dry, put them on a sealed container, cover the container for your next use. Thank you. We shall now talk about eye drop administration. Just an important information, before using the eye drops, read the label on the bottle carefully. Record the date open on the eye drop bottle. Throw it away immediately once contaminated or after reaching its in-use shelf life as recommended by manufacturer. If you need to apply eye drops and ointment together, you should apply the eye drops first before applying the ointment. Wait for 5 minutes before applying another eye drop or ointment. Some eye drops or ointments may cause temporary vision. If you experience blurred vision, you should avoid driving or doing things in places with poor lighting. Now to start, wash your hands thoroughly with soap and water and dry your hands before instilling the eye drop. Then, shake or roll the bottle gently to mix the content well. Remove the cap from the bottle and place it in a clean piece of tissue paper. Hold the bottle as if you are holding a pen. Ask the patient to sit down, stand by the side of the patient, and ask him to tilt his head backwards and look up. If the patient feels uncomfortable and has problem tilting his head, you can ask him to lie down. Hold the bottle at an angle above the patient's eye. Ensure that the tip of the bottle does not touch the eye, eyelid, or eyelashes to avoid any cross-contamination. Using the index finger of your free hand, gently pull down the patient's lower eyelid and squeeze the bottle to instill 1 drop into the inner surface of the patient's eyelid. Then, Ask the patient to close his eyes gently and wipe away excess eye drops from his cheek with a clean piece of tissue paper. Remind him not to squeeze his eye. Next is perform punctal occlusion. Close the eyes and press down gently on the inner corner of the eye for 1 to 2 minutes. This allows the medicine to be absorbed and prevent it from being drained into the back of the throat. After that, recap the eye drop bottle and store it in a cool area or as instructed on the label. You may experience a bitter taste at the back of the throat if punctal occlusion is not performed. This is normal when medicated eye drops are used. Now we'll be discussing about eardrop administration. One of the important information that you need to consider before using the eardrop is to read the label on the bottle carefully. Don't use a dropper that's cracked, chipped, and dirty. Don't allow the dropper tip to touch the ear, fingers, or any other surfaces to avoid any cross-contamination. Don't warm the drops under hot water as they may become too hot and hurt the patient's ear or your ear. Don't share the eardrops with anyone else. Sharing drops could spread germs and infection. To get started, get your supplies. This includes a bottle of eardrops and a tissue or a cloth to wipe away any drips. Wash your hands with soap and water or use any hand sanitizers. Now warm the eardrops by holding the bottle in your hand for 1 or 2 minutes. Remove the cap from the bottle and place the cap of the bottle on a clean, dry surface. For bottles with dropper, check the dropper is clean and not cracked or chipped. Now let's start in putting in the drops. Position the head so that the ear faces upward. If you are giving the drops to yourself, it may be the easiest to sit or stand upright and tilt your head to the side. If you're giving the drops to someone else, it may be the easiest if the person tilts their head or lies down on their side. Then, if the bottle has a dropper, draw some liquid into the dropper. If the bottle has a dropper tip, you'll just need to turn the bottle upside down. For adults, gently pull the upper ear up and back. For children, gently pull the lower ear down and back. Squeeze the correct number of drops into the ear. Your doctor's instructions or the bottle's label will tell you how many drops to use. Use as intended only. Gently pull the earlobe up and down to allow the drops to run into ear. Keep the head tilted for about 2 to 5 minutes so the drops can spread into the ear. Wipe away any extra liquid with a tissue or clean cloth. Put the cap back on the bottle and wash your hand to remove any medicines.